Well, my background, when I started back in the 80s, I started in epidemiology. And actually one of my first jobs was related to AIDS. I was the first director for acquired immune deficiency program in the state of Georgia. So I've always had an interest and have followed this disease and the progression over the years. We're the largest community health center in Georgia, yet and still we don't have a focus on HIV. Many of our clients who we serve are HIV positive, and some of them even have full-blown AIDS. But we have not focused on that, mainly because we haven't had the resources to do it in the right way. So when we heard about this HIV conference, we thought this is an opportunity for us to get more involved and to serve the community, which is in great need. As you know, Atlanta there's a very large African American community. Most of our clients are African American, and there's a high percentage of HIV positivity in this population. What's important now is that we're now beginning to realize and accept the fact that AIDS treatment is not in a silo. Mm-hmm. It's a holistic approach, and the patient-centered medical home approach is really, I think, the greatest thing that's happening, because this allows us to treat the entire patient, not just the infectious component of it, but there's a medical component, there's a behavioral component, and other components that affect the well-being of that patient as who's diagnosed either with HIV or AIDS. So this new approach, I think, is what's really good. We can now integrate that care into what we do as a primary care-based practice. And I think that's a wonderful concept. We've always, to some degree, taken care of patients with AIDS or HIV positivity. In fact, Southside has we're one of the largest providers of housing for people with AIDS. It's called the HOPA program. Yeah. And even though that program is housed differently from our main center, we're finding we still need to integrate them into the mainstream medical care of people with AIDS. And so we've always done, this is an ideal opportunity. And of course, we started off by focusing on patient-centered medical home for things like diabetes, asthma, hypertension. And AIDS is a very logical and necessary step. We currently provide dental services for people with AIDS, but again, it's episodic. They come in, we take care of their dental needs, and we're now trying to incorporate them in the overall practice only in the fact that if you're HIV positive, you could be HIV positive and not know anything about it. And there's a good percentage of people who just don't know. And then there's people who have AIDS who now have gone on and have what you call a full-blown disease, and either have acquired one of the opportunistic infections, or they're under treatment and they maintain their well-being, which is occurring more and more frequently. So I think from a clinical point of view, there's a distinction. But from a risk point of view, it's the same. I mean, if you're positive, you can infect others, especially if you don't know. Or if you don't know, you could acquire one of the more undesirous effects of carrying the virus. And if you'd known earlier, you could have gotten treatment and prevented it. Well, one is to get the entire staff, medical providers, and the leadership to understand the concept of patient-centered medical home and the team approach. Mm-hmm. And our challenge is trying to overcome resistance to change. People are accustomed to practicing medicine in one way. The concept of just taking care of this particular illness and sending them someplace else. And that's a challenge. So getting the whole organization to change and to adopt the concept and truly practice a patient-centered medical home type of practice is what our challenge is right now. And we're moving at it. We're going to go for it. Our objective is to seek recognition at level 3, patient-centered medical home. Even though there's other levels for FQHCs, we'll seek those as well. We really want to be one of my goals and one of our visions is to be a center of excellence. And so it means that we're going to have to elevate the standard at all levels. Patient-centered medical home is an ideal opportunity to do that. The CQI process and other processes are crucial. Things like JCO accreditation and other accreditations are crucial in order to provide a standard of care that, although we're a community health center, we can stand on par with other for-profit organizations, say like the Cleveland Clinic or others. I think success for us would be that we have begun the process, or we're actually in the actual process of integrating HIV care in our mainstream practice. Mm-hmm. That our providers and our staff are familiar with it, know how to work the system, have adopted this model, mm-hmm. and more importantly, that clients, our patients, are coming to us for service, and the outcomes are good. Mm-hmm. So that's a lot to ask for in a year, but even if you get the ball rolling so that it works well, mm-hmm. then you know that it's just a matter of increasing the amount of people. So to me, true success would be, you come in and you're HIV positive, the system is going to guide you all the way through. So it's the patient-centered medical home. You get all the care you need. The staff, everyone knows exactly what to do. And the client says, you know, that was a good experience, I'm going back there. That, to me, is a good experience, a good outcome. Well, I think education is the most important thing. I mean,
education in what?
Education, our staff, mm-hmm. to know how to deal with the different populations, the cultural differences, even the sexual preference differences of people, how to deal with that, and how and to look at them all as patients. Mm-hmm. So I think that's important. Too often, I mean, for example, as a community health center, most of our clients are going to be either Hispanic or African American. Population, as you mentioned, has a higher rate of disparity, especially for HIV infections. Mm-hmm. So being aware of that, I mean, now our staff will start to recognize that when people come in, just doing a test for HIV is something that's standard. Mm-hmm. Everybody, whether they're considered to be at risk or not, needs to have that, because the rate of infection is high, and there are individuals out there who just don't know. Mm-hmm. They don't know they're at risk, or they don't know that they have it. So learning how to do that and how to incorporate this type of model into our system, I think will inevitably be a positive outcome for everybody, especially for us.